Hello everyone, today we are honored to have Dr. Raja Kamar Subhani, GP partner at Oakley Surgery in Luton, to provide valuable insights on heart attacks and heart health. Heart disease remains one of the leading causes of mortality worldwide, and understanding its causes, symptoms, and preventing measures is essential for maintaining overall well-being. Dr. Subhani, thank you for taking the time to join us today.
Thank you, Zorisab. Thank you for inviting me onto your show to discuss this relevant and important health topic.
Could you explain what a heart attack is and what occurs in the body during one?
In order to explain what a heart attack is, it's important to explain what the role of the heart is within the cardiovascular system. Now, think of your heart like a boiler within your central heating system. Now, like your boiler, there's pipes that leave the boiler. There's also pipes that return back to the boiler. Similarly, your heart has vessels that leave and also return back. There's also valves that control the direction of the flow of the blood. And there's also a heat exchange that takes place within the lungs, where there's a nutrient transfer and oxygen transfer, which then the blood is then pumped around the body. Now, if there's any inefficiencies, if there's a problem with the pump, if there are blockages, then there can be some problems that occur. In a heart attack, there are blockages that occur to the arteries that supply the heart. Now, if there's blockages, that deprives the heart of oxygen. When this happens, there needs urgent attention, as this could cause that part of the heart to die, leading to complications or even death.
What are the primary causes and risk factors that contribute to heart attacks?
So the causes are divided into two different areas. So there's ones that we can control and the ones that we can't. So things that we can't control are our ethnicity, our age, our family history, and any disorders that we're born with. Now, things that we can control are our lifestyle, our diet, exercise, if you have any conditions such as blood pressure, diabetes, your cholesterol levels, and other things such as smoking or alcohol.
Many people may not recognize the early warning signs of a heart attack. What symptoms should individuals be aware of?
So the classical symptoms of a heart attack are pain right in the center of the chest, a heaviness or a squeezing sensation that can radiate to your neck, your arm, or even your jaw. Some people may find it very difficult to breathe. You can be excessively sweating, feel dizzy, and things like racing of your heart.
If someone experiences these symptoms, what immediate steps should they take?
So those particular symptoms is to seek urgent medical attention. So either 999 or someone to take you straight to A&E. Avoid any exertion. But the main thing is seek urgent medical attention.
Prevention is always better than treatment. What lifestyle changes can individuals make to lower risk of heart attacks?
Yes, you are correct. Prevention is better than cure. It's important to have a balanced lifestyle. So controlling things like your weight, your eating habits, so making sure that your diet is balanced, exercise, stopping habits such as smoking, reducing alcohol intake, reducing stress. These are some of the things that you can do for prevention.
Stress is often linked to heart disease. How does stress impact heart health, and what strategies can individuals adopt to manage it effectively?
So yes, stress is a key component. Stress increases blood pressure, it increases inflammation, it triggers doing certain habits such as overeating, not exercising, and this puts a burden on the cardiovascular system. Chronic stress can release certain hormones within the body and also burden the cardiovascular system. Now, some of the things that you can do are things like meditation, exercise. Some people may need to offload and speak to people. Some people may need something structured like counseling. Others may need medication. But if you need medication or counseling, it's important to seek medical attention in the form of your GP or local services such as the well-being service for counseling.
How significant is diet in preventing heart disease? And which foods should individuals prioritize?
Diet is very significant in making sure that you have a balanced diet. So having nutrient-rich food, eating your fruits, your vegetables, having lean proteins, making sure that you avoid saturated fats. So saturated fats being any processed food, fried food, butter. We're using alternatives such as olive oil, white fish. These are healthier fats that you can use.
How does exercise contribute to heart health? And what type of physical activity would you recommend?
So exercise is very important. Exercise reduces your blood pressure, it reduces cholesterol, improves your diabetes, your sugar levels, and it strengthens the heart muscle, which then makes the pumping of blood around the body very efficient. Now, the recommended allowance is 150 minutes over a week. So I usually recommend to people to break that down into 30-minute intervals, so 30 minutes about 5 times a week. Now, some people may not be able to do this. So I usually advise to start 5 minutes, increase to 10, 15, and so on.
Are there any differences in heart attacks symptoms between men and women?
Yes, good question. So men typically have classical symptoms, such as chest pain that radiates to the neck, arm, or jaw. Women usually have subtle symptoms. They can have chest pain, but they may have dizziness, nausea, backache. So in order to avoid delays, it's important to recognize these differences.
Before we conclude, Dr. Subhani, what advice would you like to give our viewers regarding heart health and prevention?
So I think the main thing is first making a decision to say, I'm going to make this change. Then it is important to have a plan, making sure that you make incremental changes, so whether it's in your diet, whether it's in your exercise, and be consistent and patient.
Dr. Subhani, thank you for your time and sharing your expertise on this crucial topic. Your insights have been extremely valuable.
Thank you very much, Zawsab. Thank you.
If you found this discussion informative, please like, share, and subscribe for more expert insights on important health topics. Thank you for watching and take care.
आप देख रहे हैं एक्सप्लोर यूके ज़हूर अहमद के साथ।